Hi, this is Sagar Wagle, one of the musculoskeletal radiology fellows at Stanford University. We have a 14-year-old high school football player with left wrist injury during a football game. In this zoomed in lateral radiograph of the wrist, this is distal radius, this is distal ulna. We can see that the epiphysis of the distal radius has shifted posteriorly. This oblique lucency going through the metaphysis indicates a fracture. So in this case, the fracture goes through the metaphysis and out through the physis. And this fracture fragment has dislocated slightly posteriorly. Growth plate, also called a physis, is the weakest point in a pediatric skeleton. Physial fractures are classified according to Salter-Harris classification. In type 1, the fracture goes through the physis. In type 2, the fracture goes through the physis out through metaphysis. In type 3, the fracture goes through the physis out through epiphysis. And in type 4, the fracture goes through both metaphysis and epiphysis. This can be remembered with the mnemonic SALT, which corresponds to type 1, type 2, type 3, and type 4 Salter-Harris fractures. S indicating the fracture going through the physis, A fracture going above through the metaphysis, L for fracture going lower through epiphysis, and T representing fracture going through both metaphysis and epiphysis. So this is our original radiograph, and this is post-reduction radiograph, and we can see that the displaced fracture fragment has come slightly more anteriorly and there's improved alignment. This is 2 weeks follow-up, this is 4 weeks follow-up, and in 4 weeks follow-up we can see some periosteal reaction. This is 6 weeks follow-up, and this is 7 weeks follow-up, and here too we can see some periosteal reaction and some callus formation anteriorly. So this is our pre-reduction radiograph, and this is our radiograph at 7 weeks. If there is high clinical suspicion for fracture and radiographs are negative, CT and MRI can both be considered. MRI has the highest sensitivity for fracture. However, it could be challenging to get MRI on time, so CT is also a good alternative. Thank you for watching the video.